wash my hands. Okay, now I'm going to go ahead and introduce myself. Hi, I'm Stephanie. I'm going to be your nursing assistant for today. So I'm going to go ahead and check your ID bracelet. Even though they're unconscious, you still have to introduce yourself and explain what you're going to be doing today. Okay, so her name is Miss Silva, and is correct. Okay, Miss Silva, so what I'm going to be doing today is I'm going to go ahead and do some oral hygiene on you, okay? Some oral care. So I'm going to go ahead and get everything set up in here. It's all set up. I'm going to raise her bed just for proper body mechanics, so I don't injure myself as well. I am going to raise up the head of the bed for 30 degrees. Because I'm not going to move her entire body no out of position. I'm just going to move her head to the side. So raise it up. You do have to make sure when you're raising up the bed that both the side railings are up, just so nothing, she doesn't tend to roll to one side and one of them is off. So go ahead and do that. Put some gloves on. So I do have all my stuff set up and ready to go. So what I'm going to do is I'm going to put on a clothing protector or a towel right under her neckline, and on her across her chest, so she doesn't get dirty in any way. So I'm going to go ahead and tilt her head to the side because I am doing oral care on an unconscious patient. So what I'm going to need now is my niece's blanket, and make sure you either have mouthwash or some cleaning solution for her mouth. So what you're going to do is get one of these swabs and dip it in the mouthwash. Make sure there's some on it. You are going to bring the niece's face into her neck, at the bottom of her chin, right there, tuck it under so if anything falls out, you can just go ahead and catch that. You're going to use a tongue depressor to go ahead and open her mouth. So I'm going to go ahead and open her mouth for me. Then what I am going to do is I'm going to go ahead and just check around first, make sure everything's fine. I do see that she does have a sore on her lip. I don't know if you can tell. It's right there. So we're going to go ahead and, just check up here really quick. Everything else is fine, just that area. So I'm going to go ahead and just pull her mouth down with the tongue depressor and, swab the top of her roof, swab that. We toss this away in the trash can. Then we get another swab, dip it in mouthwash, and, just swab around her teeth, on the next area of her teeth, and all that. Every time you do swab in a different area, always use a different swab for that area. So do that again. Swab the bottom of her teeth right there, sides, the back of the teeth, and then get another swab and swab the bottom of her tongue and the top of her tongue. So we swabbed all the areas now. I'm going to go ahead and take out the tongue depressor from her mouth, and I am going to take the niece's basin away from her. And then I'm going to go ahead and make sure her face is dry, so I'm going to pat dry her face. Never rub, always pat. And then bring this towel away from her and throw it in the dirty linen. And then we go ahead and just take off the gloves, and we're all finished with that procedure. We clean that up at the end. First you got to reposition your patient. Make sure she's, good enough, she's in a position where she needs to be positioned. Go ahead and get her set up and put her back down. Go ahead and lower her bed. Bottom always in the lowest position. You never want to leave it up high. She can, even though she's unconscious, she may tend to roll over, or you never know, she might wake up, or just want to make sure she's on the lowest position. And always lower her bed down to where she wants. Go ahead and position the call light right next to her, just in range, where she can reach it. Right here, that right there. Now for the railings, railings are a restraint, so it does say on her form that she does have to have the railings up because she is unconscious. So go ahead and leave those up. But otherwise, if it's not doctor's orders, go ahead and bring them down. So she's up there. Then go ahead and clean up my area, dispose of it. Make sure that dispose of this, clean linen and dirty. And make sure she's all fine. closing procedures. So I did oral care for you today. Re-explain what you did, even though she's unconscious. I did oral care for you today. Everything seems to be fine. You do have a sore on your lip, so I'm going to go ahead and inform the nurse about that. And then, the call lights right there, so it's within reach. And I'm going to go ahead and leave. And, wash my hands and go ahead and